Hey everybody, welcome back. I'm Matt Brown, co-host of Dental Unfiltered, and today we have an awesome episode. It's a Q&A episode. You know, here at Dental Unfiltered, we added a couple shows. We added Management Unfiltered with Zach Shelley, and we added Clinical Unfiltered with Dr. Sasha. And then me and Andrew have our own show, Dental Unfiltered, we normally have. And today we wanted to bring all four hosts onto one episode for a Q&A. And they're questions you guys posted on the internet for us. So we're going to kind of go through this. What we're going to do is we're going to pose a question to a particular host, and then if another host wants to chime in and say something, they can. So first, do you guys have anything you want to start off with before we start the episode? Any of you three?
I'll just kick this off. I feel like I want to get through these questions. Yeah, bring them on.
So I'm going to direct the first one to Dr. Vallo, because this is definitely a Dr. Vallo question, and you two, like I said, can chime in. How do you balance maintaining patient relationships while aggressively growing your practice?
Yeah, that's a great question, Matt. And I mean, it absolutely is a challenge, guys. You know, as you aggressively grow, whether it's aggressively growing a single location or growing a multi-location group, trying to maintain that patient experience, it can be difficult. I think trying to maintain consistent experience can be difficult. Matt and I actually talked a little bit about this on one of our recent episodes, but essentially what I had said is, it's one thing that DSOs do is that they have set systems, and they tend to have less highs and less lows. So, while they may not have that over the top, just absolute wow experience that we sometimes can find in private practices, they tend to have less of those horrible experiences as well. And the reason for that is systems. So I think that's what everything comes down to, when you're talking about growth, is you've got to have systems in place, for everything that you do, from, how you check a patient in, what your office tour looks like, what kind of questions the patient's asked as they walk in the room. If you do offer amenities, do you actually have a system to ensure that those amenities are being offered and being given out? What is your system for asking about patient experience, with feedback and reviews? So I think that is what it really comes down to is you've got to put systems in place before you start to grow aggressively. And then even as you grow, systems are a living thing. They're not set in stone. So you have to be willing and ready to adapt those systems and change, as needed.
I kind of get where the bulk of that question's coming from. There's patients who are like loyal to Andrew Valo, and now Andrew Valo is like nowhere to be seen. Like there has to be some, like I'm the patient. I'm like, hey, cool, new doc. Where's Andrew Valo? Like, what's the conversation right after that? Like, what gets triggered to happen to fix that problem?
Let me chime in there because, sorry, Andrew, I don't want to take that away from you, but we kind of currently have that here at our practice with the owner, kind of tapering off some days, and we have new docs coming in. It's this passive trust from the patient to the new provider. And when, like, Dr. Vallo says, hey, I've got Sasha, he's amazing. He's actually my own dentist. He's going to take great care of you. And you pass this trust to the patient's like, oh, that's Dr. Vallo's dentist and they're taking care of me. Yes. So you use that and you build that trust between the patients. And then what happens is, like, Vallo, you're saying, is that consistency. And then you've transferred that trust. And then the patient's like, hey, you need to come see this guy. And then when you add new associates, you don't have that issue because it's not like, oh, I only see him. It's like, no, I got the next best thing now.
Yeah, no, I think that's a great point, Zach. And, I tapered down my schedule. So, I went from full-time 3 days a week, 2 days a week, 1 day a week. So like that did kind of happen naturally. I didn't go full-time to all of a sudden I was stepping away from the chair. And I was dealing with some back and neck issues. And I think some of my patients were aware of that. And I was, visiting the chiropractor regularly and things like that. But I think part of it too is you've got to have the team trained and ready on that verbiage to use, because sometimes it is sometimes you are able to introduce the other doctors to the patient, and sometimes you're not even there to do that. So, your team, your hygienist needs to know what to say, your assistants need to know what to say, your office manager needs to know what to say, your dental concierge or treatment coordinators, everyone needs to kind of understand what is going on and how to build that trust and that comfortability with the patients, with the other providers in the practice. So I think you're absolutely right there. You hit the nail on the head.
All right. So moving on to the next question. I'm going to use for Zach Shelley. I kind of want to rotate through all three of you. I want this to be framed in the frame of an office manager, Zach. What are the most common mistakes new dental practice owners make, and how can they be avoided?
Oh, that's a great question.
But as from the point of view of being the manager, like what common mistakes does your office, does a new practice owner make in your view as a manager?
Yeah, I think one of the biggest things is, new practice owner, there's a lot of ownership for themselves, right? Like they have a lot on the table as far as liabilities and, coming on, they're spending a ton of money, they're trying to grow, they want to make sure everything happens. But I think one of the biggest mistakes that happens is not that ability to let the office manager do what they're really good at and build up that OM to be the best they possibly can and invest in them in order to help them grow the practice. Because the startup dentist, the owner doc, most important spot for him to be is in the chair cutting teeth and producing. So if he's able to empower that office manager to do everything they possibly can to take that off the owner's plate, to keep that growth going while they're in the chair treating patients and keeping that patient experience, I think that's going to be the number one mistake that they don't do is put the money into the OM in order to let them do the operational part of it.
All right, let's move on to another question. I'm going to use this one for Dr. Sasha. What are the best entry-level 3D printers for small practices, and what are the main applications you like?
Sprint Ray. Not sponsored by them at all. I don't even lecture for them, which sucks for them, but Sprint Ray. And maybe Formlabs. There are cheaper printers. You can go on Amazon, get a printer for like $500. You're going to have to know more. Like if you're an entry level, it means you're kind of like tech-tarded. You need some kind of understanding of 3D printers to be able to buy an Amazon printer. Sprint Ray is kind of got their whole suite. They got so many videos specific to their printer. Their support is good. The printers rarely have issues, which is also helpful. And I feel like they're not breaking the bank as some of the other printers that might be easier to use. So I like the Sprint Ray printer. And application wise, you're jumping into it, either printing models for the sake of creating suck downs, because you can make your own Essex trays, retainers. If you already have a suck down machine, great. You can also just 3D print the clear aligner material, and surgical guides. I mean, surgical guides, you almost have to, that's like another branch of like trying to figure out how to use technology to help your implant dentistry. But if you can game it, the surgical guides, A, you charge out for them. B, it will make you more, like, it'll make you seem cooler and more of a tech-centered office if you're doing surgical guides. The way I talk about it, my patients feel like, how can I go to anyone else who doesn't do guides? The way I talk about it. And so it locks them in on that concept that that's just the future of implant dentistry. And then they're so cheap to print. And they're really honestly easy to make. And you can even have a lab technician design them and you print them. So I feel like those two are like great entry level uses for a 3D printer that'll like immediately churn an ROI for you.
Well, and let's be honest, we've got Sasha and I have Sprint Rays in most of our offices now. And in terms of technology, even though they are maybe a more premium brand, it's really not that expensive. It's not like compared to getting a Mill or a CBCT or anything like that. And I've almost never heard our teams complain about the Sprint Ray. So to Sasha's point, I don't think we have a lot of issues with it. And how much is all that time savings worth as well? So I'm a big fan of the Sprint Ray. I've never personally used it, but I know our practices, thrive on it. And we also use it for printing our, temp hybrid teeth, which saves a lot of money as well.
We use it for a slightly more advanced level, which again increases the ROI even more. But I've had all the printers. Like I've played with frozen all the way to carbons, which is a wide range of, you're talking like, $500 to like $100,000 printers. And I still consistently kind of go back to the Sprint Ray.
You hit the nail on the head too, Sasha. I was a dental technician before I got into office management. So, I dealt with 3D printers. I dealt with all the applications with ExoCAD, building all this stuff. And when you're talking about like, using a printer from Amazon, you have to learn that printer and learn how everything works. But when you're using Formlabs or Sprint Ray, they already have the slicing software that's intuitive to what you're trying to do, which is dentistry. So it already knows what you're trying to do. So it makes it way easier. And the amount of time you save and what you spend is definitely the best option moving that way.
Yeah. And they're investing in their software so much, their cloud-based software. So they're making it easier and easier and easier. Yeah, if you're a Fortnite player finishing number one, playing Roblox all night, you will be fine with an Amazon printer. But most of us are busy running offices.
I'm going to pose up a next question, and this one I think a lot of us could probably answer. This is a really good question. I think Zach and Andrew both could answer this. It's a 2-part question from Corey Bell. And it says, first part, could you go into depth of when you know to hire the next hygienist? Second part of the question, what would make sense more, to drop some insurances or add an additional hygienist?
So, I'm probably not like everybody in this sense, in that, I don't wait until all the numbers tell me, hey, I need another hygienist. I'm actually trying to catalyze the growth of our offices. And so I will bring in a hygienist before I know we really need one. And I will then pad our marketing budget. I will, try to increase new patient flow to make it work. I'm also okay knowing that they might have some holes in their schedule. So, what I don't want to do is I don't want to create bottlenecks in our offices. So, we're all startup practices. We want to grow them as quickly as possible. We want to get to 2, 3, 4 full-time hygienists. And so in order to do that, you have to be a little bit more aggressive. Now, that said, if you don't want to invest a lot more money in marketing, if you don't want to, be more aggressive in that approach, and you want to make sure, I would look at how soon can you get a new patient in through hygiene? How soon can you get a recall patient back in for their cleaning? If you're booking out too far, on those metrics, people are going to go somewhere else. New patients will call the next dentist. Even your existing patients, depending on, how much they love your office, if it's too long of a wait to get in for their next cleaning, they might go somewhere else as well, or try somebody else for their next cleaning and decide if they want to stay there or come back. So you've got to think about it from that angle too. Not just do you want to grow your practice and add more hygienists and, grow your revenue, but do you want to help maintain the current patients, and do you want to make sure your new patients have somewhere to go? So I don't have set specific, numbers for you. I don't have set specific KPIs. There are consultants out there that will tell you X, Y, Z. In my mind, I'm all about growth. So if you feel like maybe you're ready for that next hygienist, my motto is, just do it. Hire that next hygienist, invest in some more marketing, grow your practice. For part 2 of the question, I don't think there's anything wrong with dropping insurances. However, to me, that would be the last thing I would do. So I would first try to maximize the capacity of your practice. And if you've got more operatories available, you've got room for more hygienists, I would grow the practice first, let it reach its maximum potential. And then when you've got nowhere else to go, if you don't want to expand the building, if you don't have the option to expand, if you don't have the option to, or an easy option to move the practice somewhere else to a bigger location, that's the point where I would start thinking about cutting insurances. If you still have capacity in your practice, I would not recommend cutting insurances at that point.
Yeah, Andrew, I'm very similar to you. When you look at a practice and you have the inkling that you're not having enough hygiene, or you're thinking you need to grow, you should have probably pulled the trigger a month or two before that thought. Because when you create, like you said, a bottleneck in the practice, it's already too late. And it's not too late to add, but you're already missing opportunity. You're already missing hygiene spots for these patients to get in. And it's kind of that theory of like Field of Dreams, right? If you build it, they will come. We just similarly did this with our pediatric dentist that is been with us for 8 months. I've just added more columns for him before he actually needed it. And we saw our new patient load increase by like 60% on that side, just because we had the availability. We're able to take all these new patients that are pushed out 2-3 months and push them right back into, hey, we got openings tomorrow. The patients are going to love you because you've created spots for them to see them sooner. You're generating that volume, and then you're opening up spots in the latter end. Same thing goes with hygiene. First off, if you don't know your max capacity, that's one thing you should be calculating and knowing what the maximum amount.
I was going to say something about that.
Yeah. What are you capable of seeing? What is the max capacity of your office to start off with? Then knowing that, saying, hey, I can actually add 2 more hygienists full time. That should be your first goal. Say, add 1. And like you just said, Andrew, it's okay if these hygienists have some openings, because you know what that creates is patients that are in treatment that are like, hey, Andrew, you don't have your hygiene scheduled. After we're done doing this filling, why don't you cross over, get your cleaning done same day? You can increase your production same day that way, and then give the patient a better service, and you're opening up all these hygiene spots. They will get filled as long as, like you said, you're marketing for this, you're giving what the office truly needs. As far as dropping insurances, same thing with me. That would be the last thing I would do until you've figured out what your max capacity is or what your max growth you want your practice to be. So you really have to look at like, where do I actually want to be? Am I doing 1.5 this year, but I really want to be at 3? Insurance should be the last option on the table until you hit that $3 million mark.
Yeah, and think about this too, guys. Like, let's say you add that new hygienist and they've got 8 spots in their day and they're only 50% full. So only 4 patients come in and you've got 4 open spots and you're sitting there calculating all that dead time and the extra payroll and all that. But let's say of those 4 patients, let's say you only convert 1 crown. Is that 1 extra crown that you're doing worth that hygienist being there that day? Absolutely, 100%. And in my mind, that's like worst case scenario. You know, if you have a new hygienist in there and they only have 4, half their spots filled, they only see 4 patients, and you only convert 1 crown from those 4 patients. That's like bare bottom. And at that point in time, again, it's still worth it. So you've got to also think about the additional dentistry produced by having that extra hygienist there to see additional patients. The other thing to think about, guys, is like, when you realize you need a new hygienist, you can't just snap your fingers and do it. So like if you don't have the room equipped yet, I mean, most chairs typically are on a 6 to 8 week turnaround time. Sometimes they're faster. Sometimes it's even longer than that. Sometimes it could be 10 weeks. You can't, if you don't have a computer in there, you've got to get your IT company to get all that stuff set up. And think about the hiring market these days. It's not very often you put an ad up for a hygienist and all of a sudden the next day you have a great candidate ready to start. So
yeah, seriously, hygienists, where are you? Where are you, hygienists? We're coming
seriously.
for you.
So I'm just basically, by the time you realize you need it, like Zach said earlier, it's probably too late. You need a plan ahead for these things.
Just real quick, I'm not going to add much to that, but we had Kelly Schwartz on, and he said, one hygienist can handle on a 4-day work week 764 patients, and then like you look at practices, like I have 3,000 charts and 2 hygienists, and just the math doesn't work, right? It's just like there's always this chicken or the egg scenario, but it's like you need more hygienists, right? So anyway, and they're hard to get on. So I want to, since that was a question you both could pretty much answer, I'm going to go on to Dr. Sasha now. And this one is kind of vague, but the world now is like every doc wants to, like I think 6 years ago, every doc wanted to do implants, maybe 10 years ago. Now every doc wants to do full arch, like every GP wants to. And there's, it's like a great unknown, right? So the question we have is pretty good. What is the most challenging aspect of full arch implant cases? And how do you recommend overcoming it?
I'm gonna give 2 answers to that question. One is, it has to deal with everyone on this podcast, our co-hosts, is getting them in your chair and winning them over. I do think that can be a challenge for most people if they're not doing the right marketing. These are, especially in Florida, these guys are all price shoppers. They are actual shoppers, almost more so, I think, than like a regular dental patient. And so you have to almost funnel them in a different way to your office. And I think some offices, if they are getting into full, they're super excited about implants. And normally if you are a doctor like that, your head is more clinical sometimes than it is business oriented. And so you will miss the opportunity to drive them into your chair to then suddenly make all the other challenges of full arch implant dentistry easier because you're practicing and doing a lot of that. I think that's probably number one. I think probably if we look, for us, it doesn't feel that way because we're doing a good job bringing them in, but I can imagine for the general population of dentists, that's probably chokehold number one is just, getting patients in and doing the treatment, being able to funnel them in when you got people who are marketing better and bringing them chairside and giving them chances to close on those kind of cases. Actual clinical wise, like doing the physical cases themselves, I'm jaded because I feel like now they're easy, but I'm trying to think. Probably the most challenging portion is, I'm going to say this is going to be different for every provider, but I feel like just patient management as far as, hey, how to manage your temporaries, how to kind of psych them up for the procedure itself. And through the process, the transition, because these patients go through some of the biggest dental transitions that anyone can go in the dental field, is going from like 1 or 2 teeth or sometimes a whole mouth of teeth with cavities to prosthetic teeth on implants. And this transition, if you're not good at communicating that they're about to do this, sometimes can really throw them off. And then you have an issue with, either their aesthetics, their bite. They're not like they come out of the surgery and start chewing on steaks right away, which a lot of times I don't like them doing. So that communication suddenly causes, if you didn't communicate it properly, you now have weird complications while they're in their temporary teeth or before they get to their final teeth that you probably could have managed by getting them ready for that transition. Otherwise, like implant part, you do a few, you do 4 or 5, you start getting the hang of it. That's it. You can overcome that. There's obviously cases where there's limited bone and then you have to learn to take on other skills. But those are all, again, I feel like that part, the tactical skills can be adapted well. There's not too many challenges in there. It's more so patient management.
So what I'm hearing from Sasha is the clinical part's easy. You could just watch a few YouTube videos and you're good to go.
Yeah, watch this podcast. Yeah. We'll figure it out.
No problem.
YouTube is the full arch education area now.
But I do want to go back to the first part of the question that Sasha answered, and I think it's a tale as old as time, guys. Think of how many docs out there will invest hundreds of thousands of dollars in advanced, education, equipment, technology. They're all ready to go, and then they do like 3 full arch cases a year. And to Sasha's point, how are you ever going to get more efficient, more comfortable, doing these procedures if you hardly ever do them? What builds your confidence is practice. And so you need to do a lot of these cases to really get more efficient, more competent at them. In order to do that, you need at bats, you need butts in the chair. So if you're willing to invest all that money in training and technology, don't you think maybe you should invest a little bit more in marketing to try to get those patients in the door? I think that's a really good point. And I mean, think about it too. Like these procedures, it can be like buying a car. So don't people shop around when they're buying a car? Don't they go to different dealerships and look online and go on Auto Trader and Car Gurus and all those things? You better believe they're going to do the same thing with these expensive, full arch treatments. So they're going to look at ads online. They're going to probably go to a couple different consultations. So, I mean, one is, can you get them in your office? Do you have the marketing that works, that attracts those full arch patients? And then once they're there, do you have a value proposition that's going to help seal the deal? Because unfortunately, once they leave the office, it's much harder to close that big treatment. And they're probably going to go to a second opinion consultation, their next one. And it's very likely they'll end up deciding to go with that one because people do want to shop around. Right. They don't want to go to 6 or 7 different offices. So they might go to 2 or 3.
Listen, you're not the Chevy dealership. Listen, there's shoppers, but like you're not the Chevy dealership with a new Corvette. No one's like, man, I want to go try that Doc's ADEC chair out. They're there for a purpose.
I feel like someone was looking for a clinical answer to that question, and this is like
too. And you guys went.
I know, and I feel bad about that, but I will tell you, like a rebuttal to that is like, what's the hardest part of like doing a crown? Probably nothing if you're doing 10 crowns a day every day. And I do feel like that, like I said, that is the rate limiting step for most of these doctors. Is that like, okay, I'm having issues with this part of the procedure. Do enough of them, you probably won't.
I think there's 2 like lines. There's 2 like lines of resistance with this. We're gonna move on. I think the first line of resistance, like you said, is the marketing, like get people in the chair, right? Because then you get reps at doing it, you get clinically confident, you have opportunities, you're planning cases better. I think the second line of problems is, can your case presenter close $40,000 cases?
Well, and do you have a treatment coordinator? Because a lot of offices don't even have that, which to me is crazy, but yeah.
No, like, listen, doc, if you're listening and you're doing full arch work and you think you're going to sell that treatment on your own and communicate to the patient clinically and go to other dentistry in the building, you are sadly mistaken.
Yeah, and I don't think people understand that the whole full arch, like all on X concept was designed to make the process easier on the doctor and the patient. So tactically, it is easier versus like an FP1 where you're like not tabling bone. Those can be a little bit tricky because you got to get like angulation right, positioning right. But in general, the full arch concept is designed to be easier, like on everybody. So there are less challenges in those cases. I will go into episodes about it and talk about choke points on the specific procedure, but
here's one that I think kind of everyone can chime in on, but I want to direct it to Dr. Vallow. This is kind of like, I don't know. This is a tough one. What are the most effective ways to market a startup practice on a tight budget?
Yeah, I think, unfortunately, it's kind of an oxymoron there, startup and tight budget. I do understand where they're coming from. Obviously I've been there now 9, 10 times, doing a startup. And I do understand not having cash flow coming into the office and all that stuff. My advice is not to put yourself in that situation. So, unfortunately, if you're already there, and I'll get to that in a second, but my advice is, plan ahead, take as much lending as you possibly can get. So I noticed there's some docs and consultants out there that try to tell you to do these lean and mean startups and, take as little money as you can and, all this stuff. I went the opposite route. So with my first startup, I asked the bank, I said, how much money will you give me? Like, what is the most money I can get for this startup process? And they said, here it is. At that time, it was $600,000. I said, I will take $600,000. So I wanted to make sure that I had enough money in the budget for working capital, which was going to include marketing. My recommendation, when you open a startup is that you have at least 75,000 in working capital after you've done all the other expenses for the practice. So that 75 grand, that's going to give you initial marketing budget for those first couple months. And as you guys know, I'm pretty aggressive. So I'm typically budgeting $15,000 to $20,000 per month for a new startup to make sure that we're getting enough new patients in the door. But even if you're not that aggressive, like in my mind, you've got to dedicate at least $5,000 to $10,000. So these startup docs that are only budgeting $500 for Google Ads or maybe $1,000, your growth is going to be so slow. And there are things you can do that don't cost money. Like those things only go so far. So my first piece of advice is plan ahead. Don't put yourself in those situations. Take as much lending as you can get, especially if it's your first startup. And on top of that, I would not recommend doing a startup until you have enough in your personal savings that you're not relying on your office, paying you a salary from the get-go. So don't put yourself in a corner. Now, let's say, it's too late and you're just hearing this now and you've already put yourself in the corner and you only have, $10,000 in personal savings and you only have a very small chunk for working capital. And let's say you truthfully really do only have $1,000 a month that you can budget for marketing. What I would recommend doing with that is I would take that full $1,000 and, I would spend it on either Google or Facebook ads. I wouldn't try to split it up. If the money is that small, if you try to split it in different categories, it's not going to do anything anywhere. So I would, if you only have a very limited marketing budget, I would either put it towards Google and market towards new patients and emergencies, or I would put it towards Facebook and maybe market towards specific procedures you like to do, like cosmetic cases or implants. Unfortunately, at that time, you're going to have to really hustle. So you're going to have to get out there in the community. And I would take advantage of every free or almost free event you can do. So I would join the Chamber of Commerce. I would go business to business. I would find the local markets and set up booths and, talk to patients. When you do these things, like you want to actually get contact information, you want to bring sign up sheets. You want to have something that's going to attract, you can talk about how amazing your office is and what a great doctor you are, but you've got to have things that are going to attract patients in the door as well. We do free whitening for new patients. So to those docs out there that feel like you have painted yourself in a corner, there are things you can do. Just know it's going to be very time intensive. And there's only so many patients you can get out of that. As soon as you are able to bring in a little more revenue, and at that point, I would reinvest in the practice and start upping your marketing budget. I would go from 1,000 a month to 3,000 to 5,000 to 10,000. That's how you're really going to grow. The other thing you can think about is even if you have, used all your lending, you might be able to get another line of credit. So I would go back to your bank. I would go to other banks and see, can I get $100,000 line of credit? Can I get $150,000? Can I get 50,000, whatever it is? Because that extra money in marketing, that's going to make a world of difference for how quickly your startup grows.
Andrew, I'll chime something that we had an idea too when you're saying, like, say you're already backed in that corner. And so you're trying to get a community involvement, right? So you're doing like local events, getting your name out there with the community. Set up a remote setup with yourself, and these patients that you meet, schedule them at the event. So you're able, instead of relying on them calling you back, say, hey, I can get you scheduled right now. Schedule them there. Get them on your books. You already know the schedule. They don't have to call you. You're already face to face with them, and start that experience right then and there. And that will be another effective way to prove that you're actually getting patients on your schedule from these events that you have a small marketing budget for.
I think that is absolute best case scenario there, Zach. I think in the very least, you need to have a sign up sheet where you're getting their, name, phone number, email address. And so like typically we'll do that. We'll do raffles. In order to get a raffle ticket, to win this, you've got to put your contact information down. But at that point in time, your team still has to follow up with all those people, and they may or may not respond. If you can actually get them, if like you said, if you have a remote, everyone these days is online scheduling. You can schedule them online, or you have remote access to your open dental or whatever it is. If you can schedule the appointment then and there, that is absolute best case scenario. And I would highly recommend doing that if your team can pull it off.
I was talking to Doc like a day ago, and he was like, I do these remote events and we take down people's information, and it just seems like it never goes anywhere. It's these pile of leads. I'm like, one, you're probably not calling them back. I said, two, why don't you just book them for an appointment at the event? Well, how would I do that? Let me just think through it. You can remote in with a laptop over a cell phone connection. Wait, we live in 2024, bro. Like, the world is connected. And I was like, simple scenario is go print out your calendar off of Open Dental and just write the names in. Like, if you really can't remote in, what's the worst case scenario? You don't have his own double booked. Well, you got twice the amount of patients. Who cares? Figure it out, right? Especially if you're a struggling startup, but then you're trying to strive for schedule perfection. It's like, well, sometimes chaos is what happens, right? And chaos is growth. So, like, I agree. Just go book them at the event. All right. That was a really good one. All right, next one. All right, so this one, that one's this one's similar, and I hate this question. Actually, I hear it every day. What's the right marketing budget for a startup? So I think that's kind of similar but different because there's a mindset problem with this one.
I mean, the question is, how fast do you want to grow? I mean, that's really going to answer the question for you. If you're okay being the average startup that does, I don't know what it is in 2025. What I was told when I opened my first startup in 2021 was that the average startup did $253,000 in their first year, whatever it is. So, these are typically part-time offices. They're open maybe 2 days a week. They're seeing a couple patients here and there. If you want to be the average startup, or you're okay being the average startup, and you want to keep working at an associate job somewhere, and you want to take 5 to 10 years to become a mature practice, then maybe you can budget $1,000 a month or whatever for marketing and just kind of let things grow organically by word of mouth over time. If you want to have semi-mature numbers in your first year, if you want to do $750,000, $1 million plus in your first year, that's where I'm saying, like, you've got to budget at least like $5,000 to $10,000. And then if you want to be super aggressive and you want to have those 1.5 to $2.5 million startup practices like we've done, that's where you get in that range where you're spending $15,000 to $20,000 a month. So the more that you invest in marketing, the more new patients it's honestly, guys, it's simple math. The more you invest in good marketing, the more new patients you're going to get, the more production and revenue your practice should produce, the faster you're going to grow. So you just have to ask yourself that question: how quickly do I want to grow this practice? Now, another thing to take into consideration is, are you trying to do a fee-for-service startup, which is something I don't normally recommend, with the exception of maybe these like specialty implant-only type practices that we do. But if you're trying to do a general fee-for-service practice, you probably need to spend even more money on marketing because you're limiting your patient pool in those situations. So there's a couple different factors that come into play. There's not a right or wrong answer. It just depends on how quickly your growth trajectory wants to be. So
with these kinds of questions, I think docs are looking for like a rule of thumb to give them some kind of comfort. I think they have to understand practices are as unique as fingerprints, and so are markets and conditions and the experience. I mean, like, there's a lot of factors here, and docs are looking for like this thing to latch on to. Like, if I spend this amount of money, that should be where I should be. And docs, the reality is that that's not real. But what I will tell you is, and then we'll move on to a question for Zach, so we have to wrap this up. What I will tell you is the number one killer of growth in a practice is undercapitalization of your marketing campaigns. Like, when I say you guys undercapitalize, you guys try to do things way cheaper every time, all the time. And I will tell you this: if you're spending $2,000 a month or less on marketing, you are donating money to the social media platforms anywhere in America.
I want to touch on one thing you said real quick, Matt. So, Matt had mentioned, it does depend on where you're at in demographics. And that is true. If you go into a town where you're the only dentist and you're super rural, you probably don't have to spend nearly as much on marketing. But keep in mind, guys, because there is like that common advice, like, hey, if you're doing a startup, go rural. Okay, yes, maybe there's less competition and maybe it is cheaper to acquire new patients. But keep in mind, guys, like, if your vision one day is to have a large group practice with multi-doctors, it's a lot tougher to attract other dentists to these super rural areas. It can be tougher to find hygienists. It can be tougher to find assistants. So, everything has give and take. I'm not a fan of that blanketed advice of go rural that seems to be so common in dental. If you want to live in a rural area, that's great. Go ahead and do it. If you don't mind being a solo practitioner and maybe having trouble even selling your practice one day because it can be tough to sell those rural practices, like that's fine. Go ahead and do it. Yes, you will likely acquire patients for cheaper. But my advice is go where you want to live, because I'll tell you what, the markets I'm in Tampa and now Southeast Florida, Miami, super competitive markets. And my startups have all been successful. So you can be successful in any market. You just have to be willing to invest in good marketing to do it.
I just asked ChatGPT, like, just because normally I feel like it's normally timid. Established practice, 3 to 5% of your annual growth. I know you guys hate the whole percentage thing. Or newer, aggressively growing practices, 7 to 10%, sometimes up to 12% on highly competitive markets, which I actually think actually kind of on somewhat better on point. I thought it was going to be more conservative.
I think it's more aggressive than I thought it would be.
We are typically in the 10 to 12% range, especially for the newer offices. So that's kind of right on point with what we typically spend. So
we have to wrap this up real quick. I have one more question for Zach, and we're wrapping this up. This is, I think, a really important question. Generational leadership. How are you motivating employees and retaining employees? So I think generational leadership is like you have leader level 1, they move on, next leader rolls up with the same culture, and you're creating leaders over leaders. So generational leadership, how are you motivating employees and retaining them, Zach?
I think it's the same way a doctor does it for an OM that we always talk about, right? Like, you as the office manager and leader need to empower your team to do more and more every single day and give them the ability to grow and delegate these responsibilities to them, give them the education, lift them up. Like, nobody's going to be successful if they're delegating things but still have a grasp on everything. So you need to be very intentional with your team of what you're giving to them, how you're wanting them to grow. You want your front desk, your treatment coordinator, you want them all better than you are at them. Your insurance and billing coordinator, you want them to be the best they possibly can be. If you lift them up and make them the best they can be, that's best case scenario for you, because then you're able to internally promote if you have a higher position that you need available. And then it also shows that they can trust you as their boss to come in and say, hey, I'm going to give you everything, every tool possible to be the best you possibly can in this industry. I want you to be the best treatment coordinator I've ever seen in dentistry. I want to see you the best front desk I've ever seen. And that's the same thing that we always talk about with the doctor investing in the OM. If the doctor starts with this, it makes it way easier for the office manager to pass that down because they've experienced that same treatment. And this is where you start building that generational leadership. You increase the culture in the practice because you have your boss is looking out for you. Say, hey, I just found the CE course. I want you to take it. This is going to make you way better at, XYZ. You do it for your assistants. You do it for your hygienists. You do it for your front desk. You do it for your sterile tech. You give every single person in this office the ability to grow and to learn to be the best they can.
Well, we have to wrap it up because all you awesome dental professionals that are in offices every day probably have patients lined up and employees looking to talk to you guys. So, Sasha, I think I had to go do a post-op real quick. So we're going to probably wrap this up here, guys. Hey, guys, thank you so much for tuning in for the Q&A session for Dental Unfiltered. It's nice to have all three main guests on the show and me as the guest host to ask them questions. Hey, guys, we're going to do this again in a few months. Give us some more good questions for Zach, Andrew, and Dr. Sasha. Please hit like, subscribe, and follow. Thank you, guys. Have a great day.